Well, hello, and welcome to our webinar on how to efficiently manage and process your unapplied money, your line item credits, and your refunds in NextGen. My name is Tom Seco, and I am the Business Development Manager for DAS Health. Before we get started on today's webinar, I want to cover a couple items regarding the webinar. First of all, I want to let you know that this webinar will be recorded. Second, everyone's phone will remain muted throughout the entire webinar. So if you do experience audio issues, please use the chat box to let us know so that we can resolve them. And lastly, I also want to let you know that there's not a one-size-fits-all solution for the ideas that we express in today's webinar. I'd also like to introduce Joe Scholes. Joe is our Product Solutions Director, and he and his team developed the solutions that we are talking about today. I'm going to take this as an agenda, what we're going to cover today. I'm going to take about 90 seconds in the beginning to introduce you to DAS Health. You'll see throughout the discussion today and the demonstrations, there's three common themes with all of the add-on products that Joe and his team have developed over the years. First of all, first theme is making the job easier. The second theme is making processes more efficient, and the third one is saving people time. So you'll see that. I think you'll get that through the demonstrations and the discussion. You'll see how you can make the processing of unapplied money and co-pays much easier. And if you do take deposit money, we'll show you how to manage that much easier as well. And then I'll show you how you can make the processing of line items and refunds much more efficient. And then, like I said, at the end of the presentation, we'll answer any questions that you have. And as your questions come up, you can type them in the questions area of the webinar control panel. And like I said, we'll answer them at the end. So who is DAS Health? We are a leading provider of health and IT management solutions. We're a trusted consultant to many physician groups, hospitals, and healthcare systems across North America. We have 20 plus years of experience with NextGen. We have a broad and deep portfolio of services to offer our clients and prospects. We have over 200 employees in the company, and we've worked with over 425 clients that use NextGen. Our passion is to work with our clients to improve patient care, work with our clients to enhance the patient experience, and work with our clients to maintain a financially healthy practice. Our mission is to improve the healthcare experience by delivering the highest value health and IT business solutions to our clients. During the past 20 years, we developed a strong relationship with NextGen, and we continue to develop and grow that relationship with them as well. And the bottom line is we're here to help and serve you in any way that we can. This is a quick look at our solutions and services model. I'm not going to go into each area, but I will point out that we've divided it into three areas: practice management, information technology, and patient care. The products and solutions that we're talking about today fall underneath the productivity products and enhancement area of the practice management area. So back to today's webinar on how to make the processing of unapplied money and line item credits and refunds a much more efficient process, and how you can accelerate that process through the automation and streamlining that occurs with the products. And as I mentioned earlier, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you do experience audio issues, please enter those issues into the chat box, and we can work to resolve them. And like I mentioned, also, any questions, you can type them into the questions area of the webinar control panel as well. So what we're talking about today is, there's two types of credits in NextGen, as you most likely know: line item credits and unapplied credits. The line item credits typically occur because of overpayments and erroneous adjustments. And the unapplied credits typically occur when you receive money in advance of a service being rendered, like receiving co-pays prior to the office visit, or maybe, like I said, if you take deposits prior to any type of surgical procedure or diagnostic procedure. And also if you take payments through third-party applications like kiosks or tablets or any type of third-party service, those transactions can come into NextGen as unapplied money and be categorized as that. So this is a busy slide. I'm not going to go into a whole lot of detail on this, but I want to point out that the Unapplied Deposit Manager software deals with the unapplied credits in your system. So dealing with the unapplied credits at the encounter level, dealing with the unapplied credits at the account level, and like I said, any types of deposit money that comes in as categorized as unapplied money as well. That's the Unapplied Deposit Manager. The Refund Manager deals with the line item credit side, and you'll see that we integrate with your accounting application to move the refund information over there as well. This is just a slide that shows the process improvements of the unapplied. The lighter color boxes are the activities that you no longer have to do manually. The software, when you run the software, it does it for you automatically, built upon the rules that you tell it. So the business rules. So it'll go out and find the unapplied balances based on the business rules that you tell it. It'll go out and evaluate those unapplied balances that it finds against the rules that you tell it. It'll create all of the transactions for you, so you no longer have to manually do those. And you maintain control of the review process. You maintain control of the posting process. So let the software do all the upfront heavy lifting for you, and you just do the review process of the items that are created in the batch. And like I said, you do the posting as well. This is the process improvements of the Refund Manager software. Again, the lighter color boxes are the points along the process that Refund Manager touches in some form or fashion, either to streamline the process or to automate it. As I mentioned, it makes it much easier for you to find the credit balances on the patient accounts through the various filters and search mechanisms. We integrate with your accounting application, so accounting no longer has to enter the refund information into the accounting application. And on the back end, once all the refund checks are printed, we bring that printed check information, check number, check date, check amount, and update that on the patient account in NextGen. So manual entry of that no longer has to happen as well. You'll see 3 modules in the demonstration: the Credit Scout module, the Batch Detective module, and the Import module. Credit Scout module is one that finds all the credit balances, allows you to take action on those credit balances, whether to apply the credit to an encounter that has an open balance on it, or distribute that credit, or you want to issue a refund. The Batch Detective is the one that brings the refund information over to the accounting application, and then the Import module is the last module that you'll see in the demonstration, and that brings the refund information, printed check information back over to NextGen and updates the account there. So with that, I'm going to turn it over to Joe, and Joe's going to take you through a demonstration, and we'll answer questions at the end.
All right, thank you, Tom, and thank you everyone for taking a few minutes out of your day to join us today. We're going to switch over to my demo machine here, so you may see a bit of a flicker, but then you should see NextGen Practice Management on your screen. If for some reason the screen doesn't keep up and I'm talking about things, but it seems like the screen is further back, definitely poke in on the chat and let us know. And then normally if we stop and restart the sharing, it all comes back in sync. So I'm going to take you through the Unapplied and Deposit Manager first, and then the Refund Manager. The Unapplied and Deposit Manager has a little different philosophy on how it works than the Refund Manager, and there's reasons behind this. The Unapplied and Deposit Manager is a rules-based system. So if you think about if you were sitting down with your staff and you were doing unapplied cleanup and you were going to write out some simple instructions or even complex instructions for them and give it to them to go do, that's pretty much how the Unapplied and Deposit Manager works. You set up the instructions for what it's going to do, and then it does it every night. Each night you come in the next day, you have batches that you can review and post. So this one is kind of a batch process once it gets set up. The Refund Manager, where we're handling the line item credits, that's more of an interactive process where we're going to show you the candidates for moving line item credits and also the candidates for refunding line item credits. And the reason that's interactive is because with the refunds, we want you to have eyes on that and to verify that the credit is truly something you want to refund based on all the activity on the encounter or the entire chart. So let's go ahead and jump into this. I'm going to jump into the Unapplied and Deposit Manager user interface. Both of these get loaded as add-ons into NextGen, and work with your current NextGen database. So if you're pointing at test, it'll work at test. If you're pointing at prod, it'll work at prod, and so on. The user interface for this is written to be very straightforward. So at the top of the screen, we have what we call rule sets, and the rule sets are what you're trying to accomplish. And these are just examples of things you can do. You can actually build out your own rules to kind of refine it or do totally different things that maybe we didn't even dream up yet. So we can have one giant rule set or break it up into several. The advantage of breaking it up into several is that you can go ahead and turn them on and off individually. So if you only need one for a period of time, you can later disable it. So since we have limited time here, I'm going to take you through this real quick. But if you do want to do a one-on-one demo with your practice, please reach out to us. We'll have our contact information up again at the end, and we can spend more time discussing your specific problems and workflows and how either of these tools could integrate. So the reason I picked setting up these 4 examples are these are ones that we'd run into often in the past. So one of them was copay cleanup. We'd have all these even dollar amounts out there on the encounter sitting in unapplied, and we need to get these pushed onto the line items. In many years ago, we used to go into the database and do custom scripting to go ahead and make that happen. Now, with the Unapplied Deposit Manager, we can just read the instructions down here for the rule set, and they just read left to right. Encounter unapplied equals specific amounts, apply it up to the unapplied amount. So you just kind of pick a drop-down list, and the next one gives you the choices based on what you picked on the previous one. So if in this case where we have additional parameters to provide, it's the specific amounts, we can click in the pop-up column and it'll give us a box with the right kind of entry to put that in. So that could be date ranges, it could be location names, provider names. In this case, it is dollar amounts. So we've put in our most common unapplied dollar amounts that we're going to have the system go out there and resolve. So these other rules here just coordinate with the rule sets up above. So really this top one here is what does all the heavy lifting for that example, for the copay cleanup. So let's look at one that's a little more complex. And this is kind of a larger cleanup project. You're behind months or years on getting unapplied caught up. Everyone's screaming. Patients are screaming because their balances aren't going down. Accounting's screaming because the money's not in the right spot. So practices call us when they're on a mission to get this resolved, and it may be encounter unapplied and account unapplied. And the trick is they often want to resolve it with keeping as much in-house as possible. So this one's a little more complicated, but again, if you just take it one line at a time, encounter unapplied equals patient amount, apply it up to the patient amount. Of course, you can do this simple one in NextGen today. But what if it's greater than the patient amount? Well, we have, by the time we get over to the right here, we have 2 choices. We can apply it up to the patient amount or over apply it and put the full unapplied amount out there. In this case, we've chosen to only put it up to the patient amount. Let's leave the remaining unapplied sitting out there and encounter unapplied, because down here on the 4th line, we're going to take that remaining amount, move it to the account, and then from the account, you can go ahead and use it on other encounters. And we can refine this by adding what we call scopes. And there's a number of these that you can go ahead and do. This is a good example of one. Skip encounters with no charges, right? If the encounter just got entered, you took the payment, and maybe the charges won't get fully entered till tomorrow, you can say, you know what? Skip it until their charges. Leave that money out there on the encounters unapplied and only process it when there's charges. If you're doing a cleanup project, you may want to wait till the insurances have been settled out and they're 0, and then go ahead and apply it. Again, other things we can add, date ranges, service item codes, things like that, that can all refine these down to be exactly what you need. So these first 7 lines here are the encounter unapplied, and then we have the account unapplied. And again, same thing, remaining amount, just try and use it on the oldest charge, on the oldest encounter, and walk it forward, right? Find those balances that are out there on the account and try and use the money. And in some cases, you might have money that just sits out there. The patient isn't coming in anymore. They were in for a particular set of procedures. There's money left over and unapplied. So you can go ahead and age that out, and the system can create a new encounter with a dummy service item, push the money against that. That dummy service item would have a $0 cost, so it all becomes a line item credit, and then you could use RefundManager to go ahead and refund it. Now, when we're setting these up down here, we can say, do we want to disable it? Are we just letting it run once? Or are we going to have it run nightly by the BBP job? For the batches it's going to create, we can set up the descriptions so we know when we look at the batches what's in there. Typically, you'd go ahead and hit save, and then the BBP job would go ahead and run it. But if you're testing, you surely don't want to wait overnight for each iteration of this. So what we recommend you do is narrow it down to locations or providers or date ranges, something that's going to run quick. And again, we'll work with you in your test environment to get these rules set up. But we give you the ability to run it for several minutes by clicking the quick run button down here. And what it's showing me is just the transactions that it added to our NextGen batch. In fact, over here on the right, I can see most of these were added to the batch starting with encounter unapplied, and this last one was the account unapplied. And much like in NextGen, every transaction takes at least 2 sub-transactions, right? 2 trans detail underneath it to make the money move. So you're pulling it out of unapplied and putting it somewhere else, or taking it out of an encounter and putting it up to unapplied, things like that. So in your NextGen batch then, you'd have this and it would be available for you to review. We have some clients that are taking money in via a third-party interface and they want to go ahead and catch it by transaction code. So we have the equals, greater than, less than like before, but in this case, we're only looking for 1 or more transaction codes that were used to intake the money. And finally, the system can go ahead and take deposits. So you can put that deposit money in unapplied instead of having to create a dummy encounter or make a note somewhere. The system will go ahead and recognize it and use it for the appropriate purpose in the future. And it knows this because you tell it as part of a cross-reference. So over here on the left are different transaction codes that we'd set up in NextGen to take in deposit money. And we did this with a fertility group. So if it was fertility treatment deposit money, we'd taken the money into unapplied using patient deposit fertility. Over here on the left, we give it a name, and this is just whatever you want it to be. It could be Joe, but in this case, it's fertility deposit. And over here on the right, you'd have 1 or more lines with that same name that indicate the service item or service items in the case of multiple lines. Or if your service items are all assigned a particular modality, we can go ahead and pick that modality. Or like here, we can have a combination of them. So the system every night will watch for new money coming into unapplied. If it matches one of these transaction codes for that account, it'll go ahead and earmark that money and save it and keep watching for that upcoming encounter or encounters with the right procedures for it to use the money. So the goal here was to simplify deposit management, because in talking to a number of NextGen practices, there were quite a few schemes out there that required a lot of manual intervention to go grab the money and move it in the future. Now we're running low on time here, so I'm going to switch gears. Now that I've shown you the Unapplied and Deposit Manager, again, rules-based engine, you tell it what you want it to do, and it does it automatically each night through a BBP job. Let's go ahead and jump into RefundManager and show you what the line item credit processing looks like. So again, RefundManager is more of an interactive tool. It'll help streamline and automate your line item credit processing. It's called RefundManager for historical reasons, but it's really your line item credit tool. We start out looking through the NextGen database for credits that are out there, and there's different criteria up above where we can specify what we're looking for and how long a date range we want to process. And then are we looking for money that we want to move around or refund? If we're looking by location or provider, again, lots of ways to go ahead and slice and dice that. In a one-on-one demo, we can get into more detail about it. What I see here is I pick candidates where there's credits on one line item and debits on other line items, could be on other encounters or even cross practices if it's the same guarantor. I'm going to pick a couple of these to show how it works. So up here at the top level, we have the guarantor and the credit amount. I can go ahead and expand it down and see the account, see who owns the money. In this case, because it's patient line item credits, it's going to be the guarantor. But if it was like a refund, it could also be one of the insurances who owes the money. And then we have the encounter and then the charge down here. Since I picked distributions, which is that moving of the money, that reallocation of the patient line item credits, I can go ahead and say, you know what, just click the D checkbox for distribution. And if I want to see what it's going to do, I can do a distribution preview. And what it's telling us here is it's going to take $50 of the $50 credit, encounter 1212, this particular service item. And in this case, it's just going to move it to another charge on the same encounter that didn't get the money applied to it. So maybe only the one charge was there at the time. Sometimes we have practices who want to control this process. So I have Oscar here, who's a demo patient that we use for showing you how you can control where the money comes from and where it goes to. So last time we just let it do the default processing of same encounter, then oldest to newest. But in this case, we'll go ahead and do the manual matching where you get to pick where the money comes from. So on the left here would be one or more charges with credits, and on the right would be where it's going to. So if I want to pick the newer one instead of the older one, I can go ahead and do that. And then it's allocated my balances appropriately, and I can stop there or I can consume the rest of the money. So working the distributions, those moves, someone would go down and do that first because that gives you the ability to keep that line item credit money in-house. When you're ready to make it happen, you go ahead and tell it to process. And then instead of you creating these transactions in NextGen to do all these moves, you let the computer go ahead and do that. And it just did those transactions in a blink of an eye. So now that we've gone through and done our distributions, let's go ahead and look for money that's good candidates to refund out. All right, and normally the one I like to pick on here first is Jennifer. Jennifer has 3 encounters with credits on them. I can go ahead and expand down. I can go ahead and look at each encounter by clicking on it and see a view of the financial tab from the chart. Since there's several encounters, I can go ahead and look at the account summary and make a decision based on the payments, adjustments, charges, if I want to refund this or not. So we give you that ability to review it. And if it's one that's a real mess, we may put it out to the work log as a task. But in this case, I'm going to go ahead and pick the refund checkbox. I'm going to pick a couple others. I'm going to pick Tiffany here, who has an insurance refund because the refunds we do both patient and payer. So we can see here a couple different payers have credits out there and we need to get those returned back. Now, if you're going to do recoupment with certain payers, you could go ahead and filter by financial class so you do or don't see them here in the results. So I'll pick a couple more. And just like before, once we've gone through and done our research, then we can go ahead and say, you know what, let's process these. And instead of us creating all the 9 transactions here in NextGen, the system just did that for us instantly. So it really does streamline the process. You still get to do the review of it and analyze it, but you don't have to do the hard work of creating all those transactions. The system will go ahead and do that for us. Now to round this out today, we only have, again, a few minutes left, so I'm going to go ahead and balance this batch, and then we're going to export it out to the accounting system. Now we have about 20 different accounting systems today that we support, and that number is always growing. It's everything from Business Central, QuickBooks Online, regular QuickBooks, Great Plains, a number of different banks. So there's quite a few of them. Chances are we do yours, or we can go ahead and talk to you about what would be involved to make that happen. So I've posted my batch. At the bottom of the batch here, I have the ones that netted 0. Those were those moves of the money. At the top here, I have my insurances to be refunded, and here in the middle, I have my refunds to patient. So normally a lot of practices would go ahead and send accounting a report or a spreadsheet, and accounting would hate life because they have to go ahead and data enter that all in. Because RefundManager can interface with all these different accounting systems, we can go ahead and find our NextGen batch and export it out either by creating files to the for the accounting system or talking directly to the accounting system. In this case with QuickBooks, we're going to go ahead and talk locally, so we just pushed over the vendors and payments. Now we don't have to do any data entry. With our accounting hat on here, we can go in there and we can see that we have checks queued up and ready to print. In fact, we have Jennifer's check right here. So we do a quick review, we load our check stock, and we just go ahead and print. We're no longer in the data entry biz on the accounting side. We do our reprints here. If we need to do reprints, I'm going to tell it everything came out all right. We can see we have check numbers assigned now. So let's finish the process by pulling that check information back in to NextGen, and then we'll go ahead and jump in and look at Jennifer's chart. So I've got my 6 checks because I consolidated some, right? Instead of sending Jennifer 3 payments, we're sending her 1 check, but it goes back to the original encounters. So it says it was able to update all of these. So we can come back here and we can go ahead and look at Jennifer's chart. Helps if I type right. And we can see what's been going on our behalf, how RefundManager has been helping us as we've gone through the process and the documentation it's been creating. So we have an encounter note that was created when RefundManager actually put the refund transaction in there. We have another one that was created when we exported out to the accounting system, and this will capture the address that was in play at the time. And then the last piece of it is a transaction note that has that check number, check date, check amount, and we didn't have to do all that keying in of the check report back into NextGen. So again, it covers the full life cycle of this, bringing the information back in after the check's printed. I'm going to go ahead and turn it back to Tom to wrap up, and I see we may have a question or two out there too.
Okay, thank you, Joe. So, we realize each of your practices or health centers operate a little differently with the processes that you have in place. So as Joe mentioned, if you'd like to have a more in-depth discussion about one of the products or both products and learn more about how it would work within your organization and work with your current processes, you see our information up here on the screen, and give you the opportunity to ask questions as it specifically pertains to your processes and to your organization. So with that, we'll go ahead and answer any questions that you have. And like Joe said, there's one question in here, and it looks like it's, is this similar to account cleanup? So I'm assuming that's back to the unapplied, talking about the unapplied money.
Yes, I was just looking at that too, and looking at the timestamp on it. So yes, it is. But it's a lot more targeted, and you have a lot more control over it. So you can go ahead and design those rules, and you can have multiple rules for different scenarios so that they do exactly what you want instead of just being, a generalized go and do something. So you can separate out your copays from your cleanup, from your deposits, from your money coming in from a third-party system. And even within different locations or providers, you could set up different sets of rules. So the great thing is it's very flexible to do what you need.
So a question, does this add vendors automatically in accounts payable?
The system can go ahead, again, this is probably RefundManager side when we're doing the export out. So the system will go ahead and push over the demographic. How that works depends on the particular accounting system. For some accounting systems, it'll be vendors because that's how they work. For some, it'll be temporary payments or vendor miscellaneous payments, things like that. And for other ones, it could be multiple contact records hung off a generic patient vendor record. So there's a number of different options on you. Again, that's one of the things we talk with you about in a longer discussion.
Another question. Let's see. We have 2 practices set up in NextGen. Each practice has its own checking account. Can RefundManager work with the respective checking accounts for each of the practices?
Yes, it can. That's something, again, we'd talk with you about further based on the accounting system and your workflows. But for some of the accounting systems, it's fully automatic. For other ones, you just export different files and keep them in different folders to import into the right company in the accounting system.
Here's another question probably related to unapplied. So can I delete an encounter batch if I decide not to post the account batch?
Yes, in fact, that's part of what we recommend in the testing strategy is to put your rules out there. We'll help you get those first couple set up, and then from there, it should be pretty straightforward. And if you don't like the results, or you're like, oh man, I should have added a provider, I should have widened the date range, you can go ahead and delete that batch, which obviously gets rid of all the transactions it just created, and then rerun the rule again.
Okay, so we're at top of the hour, so we'll go ahead and close out the webinar. I appreciate everybody joining us today and learning more about how you can improve and make more efficient the processing of unapplied money and line item credits and refunds within NextGen. You see our contact information up here, so if you would like to have more in-depth discussion like Joe had mentioned, send us an email or give us a call and we can schedule some time with you. So thank you very much for joining us today and enjoy the rest of your day.
Thanks, everyone.